Hmm. So how was your week?
I had the busiest week, what I was grateful for, because I'm going to take Thursday and Friday off this coming week, and to get my procedure. So I really wanted to have a nice week, so I didn't have to sweat the money or anything like that, and it really turned out really great.
Hmm.
I had just an awesome week. I really did.
I love knowing that. I had a great week too. I
Hmm.
mean, just so sunshine and beautiful here in Colorado. And
Hmm.
I helped Tobin clean his room yesterday.
Woohoo!
I know. He was so happy, so grateful.
Uh-huh. Got rid of all the clothes that don't fit.
Yeah, and he's about to be 13. So just kind of the younger toys and stuff that he doesn't want anymore.
Right. Oh, that is such a great thing
Yeah.
to make room for the new.
Yeah. Yeah. Absolutely. Yeah. And so I'm just so excited to be here with you. We talk every Sunday anyways. But as I was preparing to talk to you in this way, I was really reflecting on how you've been a model for me over just the course of my entire life, really, about this commitment to health and wholeness of humanity with so much passion,
Mhm.
like endless passion.
Mhm.
Yeah, and I just would love to hear more just about your journey, about how you arrived to practicing medicine in this way.
Well, I swear I'm lucky. I'm really it's luck. Um, I lucked into to the nutrient-oriented medicine thing in the first place by getting an infection in my eye that my Harvard-trained ophthalmologist could not take care of. I was director of emergency services in Oregon, of course, where you were born, and I had this eye infection, and he gave me cortisone drops, and I put the drops in, and I'd feel better. And 4 hours later, my eye'd be killing me. And my friend Howard found this practice in Sacramento, and I came down here. And the guy who was here, Gary Gordon, who's no longer on this planet, anyhow, he gave me a shot in the butt of Virazyme, which is a homeopathic remedy. I got an IV of vitamin C, and I got uh, 400,000 units of vitamin A all at once, and my eye was better, like magic. So I couldn't ignore that. So I typed out my resignation at the hospital. I met the director, who I really was a great guy. He treated me phenomenally great. Anyhow, so I told him I was leaving. I found a replacement, which was lucky as can be, and I came down to Sacramento, and it's been all roses ever since. Not really, but it's been fun.
Yeah, but what I love about this story is that you recognize the magic and you followed the magic and the spark of something that was beyond what conventional medicine was saying was the effective intervention.
Right. Oh, everybody at the hospital told me I was crazy. Everybody at the hospital. I says, "What do you mean I'm crazy? I know what I know. You can tell me I'm crazy, but I know I'm not crazy."
Yeah, I mean, but what you just spoke to there is medical gaslighting, which happens to so many people all the time.
Uh-huh.
And I think you see it too with people who come to you who've had that experience of being undermined. And then
Yes,
you see them for the potential of their health and healing in a way that no other physician does.
yes, yes, that does happen. I
Hmm.
do have one cool thing that happened to me recently, I gotta tell you. So, I told you before, but I'll just say for the sake of the tape or whatever. So I got a blood test, and my PSA level was 8.9. So I go on Google because it's got AI now, and I ask what viruses raise PSA levels, and it comes up with one called HHV8. So I make a remedy to HHV8, and I take it for 4 days. 2 weeks later, my 8.9 is 5.7. 2 weeks later, it's 3.9. 2 weeks after that, which was just a couple weeks ago, is 3.1. So just in the space of 8 weeks, this ordinarily terrifying thing for men, prostate biopsies, prostate MRIs, going to get your radiation, get your prostate out. All of a sudden, it's gone. So anyhow, I got that. So I was telling Zach about that yesterday at the Mother's Day. We had Mother's Day yesterday for Lisa on uh, Saturday because Sunday's too crazy here. Anyhow, so I told that story, and I got the COVID thing, which is bothering my heart. So he says, "Well, why don't you make a COVID remedy?" So on the device, there's 40 COVID remedies. So this morning I came in instead of working out, and I pendulum every single COVID remedy, all 40 of them, and I found the one. And so I'm now taking the COVID remedy specific that I think is the one that damaged my heart. And I'm just going to see if by the time I'm supposed to go in for the procedure, if my heart isn't back.
Hmm. Hmm.
You
Yeah, I mean, and the thing that I think is so brilliant about the magic of homeopathy is that it really works with your vitality.
Uh-huh.
Like it nudges your vital force to find its way back to balance, back to health.
It's really it's so one-to-one perfect too
Yeah.
sometimes. I had a couple this week that just blew my mind. I just go one more. So I had this lady come in. She's had pain in her eye for like 8 weeks. She sees the best ophthalmologist in Sacramento, in my opinion. I won't say his name. Anyhow, she sees him, and he continues to tell her that it's something called chlamydia trachomatis, and she has to take antibiotics for like a month, and she doesn't want to do it. She has already had the homeopathic to chlamydia trachomatis at a 10M. So I know she doesn't have chlamydia trachomatis in my heart, anyhow. So I poke her fingers, and it just comes up herpes simplex, just simple canker sore virus. I give her herpes simplex, and 4 hours later, she texts me and tells me the pain is gone after 8 weeks. I mean, that's what I call homeopathic magic.
Hmm.
It's
Hmm.
just unreal.
Yeah.
It's just absolutely unreal.
Yeah, and I think that some, like you can feel the magic and know the magic. And
Mhm.
some people want to try to understand the magic. And there is a lot of understanding in science with
Mhm.
homeopathy. That will you describe a little bit about what it is and what's actually happening when you make a remedy?
To me, yeah, I'm an osteopath. So as an osteopath, we are told from day one that the body is the best healer. I mean, we are told, and it is pounded into us over and over again, bring the body back to homeostasis, bring the body back to homeostasis. And that's all homeopathic remedies do. They just balance up this negative energy back to some normal energy, and the body can then begin to repair itself for any damage that's been done. And I just, it's just so perfectly aligned. And the thing I love best, the guy who started homeopathy, Samuel Hahnemann, was born in 1755. Are you kidding?
It's
So
amazing.
I know. It's like it's been around since for 250 years, and people are still doubting it. If it didn't have any validity, it wouldn't be here,
Mm.
you know?
Yeah, when I was reading the biography on Hahnemann,
Uh-huh.
I the author really linked together how homeopathy was created around the same time that vaccines were created. That there's this like similar principle involved, but excuse me, but um, homeopathy is working with a person's vitality where a vaccine is suppressing vitality. Is
You're
so there's this wisdom about really understanding a person's vital force and how that is essential to their healing.
right. And then you put it together with optimal diet and a little exercise and then
Right.
nutrients, and before you know it, you got a healthy person on your hands.
I know that you have a really unique way of understanding your patient's inner psyche and like their inner way of moving and being in the world. And I'd love for you to talk about that a little bit.
Well, the first thing I do when I meet anybody is I want to know their birthday and their birth name. I mean, that is number one for me because I can garner so much information off of that. And what I'll do is I'll just go through my name and show Let's see, I'll just grab this here. So I'm going to show the paper on the screen here in a second. It's going to sound like a little egotistical, but that's okay. So I was born on 10/10/1944. I love those numbers, by the way. Anyhow, 1 plus 9 plus 4 plus 4 is 18, plus 10 is 28, plus 10 is 38. So in numerological terms, I'm known as a 3811, born on a 10 day. I have a 0 here and I have a 0 here. Then when I take my name and write it out, Michael Jerome Kwiker, each letter has a assigned number, like M is the 13th letter of the alphabet, and 1 plus 3 is 4. So putting consonants down on the bottom and vowels up on top, C is the 3rd letter, H is the 8th letter, L is the 12th, so that's a 3, J is the 10th, so that's a 1, R is a 18th, so that's a 9, M is 4, K is the 11th, so that's a 2, W is the 23rd, so that's a 5, K is the 11th, so that's a 2, and R is 18th, that's a 9. And on the vowels, 5, 9th letter, 5. O is the 15th, so that's a 6, 5, 5, 1, 9. So I won't go through adding these up, but trust me, this is going to add up to 36. And 3 plus 6 is 9. So my soul urge is a 36/9, and my consonants add up to 50. So I got another 0 there, which is a 5, and 9 plus 5 is 14, and 1 plus 4 is 5. So that's my whole numerological. Of my name, I have a 1, I have a 2, I have a 3, I have a 4, I have a 5, I have a 6. I don't have any 7s. So I'm missing 7s. I have an 8 and I have a 9. So when missing numbers are the key for for me to recognize my own weakness. So I tend to um, gloss over things instead of really getting into them deeply and really understanding on the deepest level. So knowing that, I try to scrutinize and double check and get into it more so that I can cover myself for that 7. The 3811, which is my main number, 11, we don't reduce, this would ordinarily be 2, but we don't reduce double numbers. 11 is double creativity, double independence. So I'm much better off working by myself, and I'm much better off just letting it flow in terms of just thinking whatever, trusting the thoughts that are going to come into my mind are really correct thoughts. And to back that up, I have a 0 here, a 0 here, and a 0 here. Those zeros are the numberless number of knowing how to read energy. So I'm good at understanding people and looking at people and reading their energy. I know during an office visit if I'm losing them. I know when to kind of reignite the fire in them to get themselves well. I had a 16-year-old in here who was diagnosed as diabetes in December, like a brand new diabetic, no family history of diabetes. So I got a chance right at the initial part of the diabetes to try and make a difference. This was Friday. So, but he was 16 and I was trying to talk to him about food and I was losing him and I had to bring him back and bring him back. But I recognize it. And by the time we left, I feel like we have a good working relationship. So we'll see what the next 3 weeks bring. The 5 makes me kind of adventurous. Um, so I do kind of take chances. Um, and my first letter that I greet the world with is an M. So I've got 2 posts in the ground. M has 2 posts right in the ground. So it kind of gives me a firm footing. just like the H for you have two posts in the ground. And my first vowel is 9. So I have that maybe 5% that wants me to connect vertically. I is vertical, wants me to connect vertically with every single thing I do. So in that, I just know all sorts of things right off the bat.
Yeah, yeah. I mean, you know so much from that. And for those listening on audio, I just want to say that you are pointing to numerology in the name that is 1 through 9, the letters
Right.
1 through 9. And so then reducing numbers that are higher in the alphabet down to its lowest number.
Correct.
And this is, if I'm correct, correct me if I'm wrong, but is based on physics. So, you know, similar to homeopathy, it's like an energetic frequency that's being measured through the name and through the birth number.
Yeah, I tell you, and I know I'm positive it's true, because I was born Michael Jerome Kwiker. So that from the day I was born. So anybody who says, "What's his name?" You're Michael Jerome. You're Michael Jerome. You're Michael Jerome Kwiker. Michael Jerome Kwiker. Michael Jerome Kwiker. That imprint has imprinted so heavily that it's me, And now, and that with the birthday, all I can say is you can know somebody so fast. I mean, sometimes I have people come in and they're missing twos, fours, sixes, and eights. Oh my God.
That's a lot of numbers to be missing.
A lot of numbers to be missing. I have two of them that I saw on Thursday. And I know I've got to be gentle with these people. They're
Mhm.
easily hurt. They're tender. Got to be very careful. I got to just nudge them along.
I have a client who has is missing several numbers, but one number in particular that she's missing is a 9.
Uh-huh.
And the way that I see her try to map to other people, right? Because that not having that 9, as I learned from you, did you use the word aimless? Is that right?
Aimless. Aimless is
Aimless.
the right word.
Yeah. And so they're aimless. And so they try to put their aim onto somebody else to be like their north node.
Right.
And it's, you know, a pattern that is really like hard for her to overcome.
It's really difficult. Overcoming nines it's hard. It's hard because it's kind of like it's not defined. Like if somebody's missing a 4, okay, we just want them to clean their room and fold their clothes and wash their dishes, and they can overcome that just by the simple things of doing that.
Well, I would say, and also for somebody missing 4s, be responsive and curious about other people as opposed to reactive for the sake of reaction.
Right, right, right. 4s definitely do. Yeah, they do that. Anyhow, so nines are tough. Nines are
Yeah.
tough because it's not totally clearly defined. It's tough to be not nines and not ones. Not ones is not easy either.
Well, and you know, I think I was probably 20 years old when you first started studying numerology. I
Mhm.
mean, you were studying astrology before I was born, because I know that the moment I was born, you or mom looked at the clock to like
Yeah.
know the exact time
Right,
of my birth.
right.
But so, you know, you and I have both been working on the you know, sort of potential of the weakness of our name for many, many years. And so I'll just say that, like, knowing for me that I have no 3s in my name, which is the only number that I'm missing, and working on my communication for as long as I've had to be in right use of speech, to not quiet myself, not complain, and like really
Mhm.
expand the energy of my throat chakra and like really open up into the vibration of 3 within me has
Mhm.
really transformed me in a way that's really integrated by this point, I'd say, you
I
know?
know you really are a model for somebody who is consciously working that energy to recognize it, overcome it, and even expand on it. Because look at all you've done communication wise.
Well, yeah. Well, and I say that too because I think that some people, when they start hearing all the numbers that they're missing, they can feel overwhelmed,
Uh-huh.
like, oh, so this is like what I'm just kind of stuck with, you
Mhm.
know? But really, it's an opportunity to expand your own capacity and to grow into a fuller expression of yourself.
Right, right. I agree with that. And also when they're missing the twos, four, sixes, and eights, I'd say, okay, you've got a prominent 5. you've got a prominent 7.
Mhm.
Let's see where those are at and just appreciate those. So you can always go back to those things, because yeah, missing a lot of numbers can be a bit overwhelming sometimes.
Mhm, mhm. Before we transition to the teaching piece that we're gonna do after this, I do wanna say that, for anybody who's listening, but also just because I love this about what you do, is you take phone calls in the morning at your office for
Mhm.
people to call in and ask you about working with you or tell you what's happening for
That's
them. Will you say
amazing.
more about that?
Yeah. Yes, I've been taking phone calls since I don't want to practice where somebody comes in just to get their thyroid medicine refilled. I did not join up for that. If somebody needs their thyroid medicine refilled, call me up, tell me you need it. I'll call in a prescription. Have a nice day. You don't have to pay me 250 bucks for that. I don't want that. I want somebody who comes in and we have something we want to work on. So I started taking phone calls. This is way back. I mean, I'll say this is way, way, way back. And it really worked out good. I could get a few things done, and the person doesn't have to come in. And it's really allowed me to expand my practice. I'm in Northern California, so I'm in Sacramento. I've got people coming from Milpitas, Novato, and uh, uh, Tahoe and Grass Valley, but they don't have to come in all the time. They can call me and we can go over a couple of things and sort things out without the travel. It really makes it a lot easier on them and me.
Yeah. And you do it for an hour in the morning, is that
Yeah,
right?
8 to 9, Monday through Friday,
Yeah.
and 916-489-4400.
Yeah.
And just if somebody wants to call and ask a question about anything, I'll give them my perspective on it.
Mhm. Yeah.
Not the right answer or wrong answer, but how I would approach that problem and how I think they should approach that problem.
Amazing. Thank you. Well, I'm really excited for people who are listening to learn more about the nutrient-oriented medical
Mhm.
perspective that you bring. So will you share more about that now?
Well, I'll tell you, the first thing that caught me, there's a guy who wrote a book from England. His name was Jacobs. I think his first name was Lawrence, but I can't really know that for sure. But Jacobs was his last name. He wrote a book called Death Begins in the Colon. And I go, Death begins in the colon. And the more I think about it, the more I think that's right. 7 out of the 13 life processes take place in the intestinal tract. 70% of our immune system is in our intestinal tract. Most neurotransmitters are produced in the intestinal tract. There's so much going on there. Between the mouth and the rectum, there's 30 to 35 feet of intestine. And so if that's working perfectly, we've got a lot better chance of being healthy going forward. If that's not working perfectly, that needs to be corrected first. I don't care if it's heart disease, if it's arthritis, if it's brain function, if it's allergies, the intestinal tract has to be corrected first, in my opinion. So that's the number one thing. And of course, with the intestinal tract, it's what you eat. And I'm a big proponent of eating according to the blood type. And just to simplify, A blood types who have the least amount of intestinal alkaline phosphatase should be more vegetarian-ish. O blood types who have the most amount, we are the meat eaters. B blood types who have this dynamic, crazy, wild intestinal tract with all sorts of things going on, they can have dairy products, and they're kind of the middle ground. And AB blood types are kind of just got to learn what to eat. They're in a world all their own. And just using that as a template really is a big, big, big factor because once you're kind of eating okay, things will straighten out.
Mhm.
That's
Mhm.
pretty cool.
Well, when you first asked me to try the blood type diet, I was about 20 years old and was like, no. And you said to me, just for 30 days, please. If you don't like it after 30 days, you never have to revisit it again. And I'm an A, and one of the things growing up in California that's so prevalent are nightshades. And I had chronic inflammation throughout my entire life that made it hard for me to stand sometimes or hold a fork or a pen. And I mean, I think it was probably 2 weeks in to taking all nightshades out of my diet that I felt like the inflammation was gone. Like I could move in my body again.
Yeah. Yours was an incredibly special case because you had these things called anti-nuclear antibodies, and your anti-nuclear antibody level to this day was the highest I've ever seen at 1 to 2560. And it got down to normal. And the rheumatologist we were seeing said, no, they'll never go away. And sure enough, took about a year, but they were gone, zero.
Yeah,
I know it's a miracle.
it really is a miracle.
Right.
Right. And so there's the inflammation and there's the protein, but there's, so much more to understanding even just how a blood type A would eat versus a blood type O.
Right.
Yeah.
A's have the highest metabolic rate, so A's want to eat a little bit, a little bit, a little bit, a little bit all day long. O's who have the lowest metabolic rate, I eat a big old honking meal, and then I don't eat again, really and truthfully, for 8 hours. I can go 8 hours on just breakfast. And it says there's nothing, I don't need anything because I'm burning so slowly, whereas you burn super fast. So you're feeding just a little bit, just a couple of peaches, just a couple of cherries, just a half a peanut butter and jelly sandwich. Just a little bit.
Yeah. And so death begins in the colon, which I
Yes,
guess what we're really saying here is, and vitality and life and health begin in the colon.
I really think so. And that's why for an A blood type, I'll just say aloe vera juice and a probiotic called Polyflora A, which is for sale on Amazon. And for a B blood type, it's chlorophyll. B blood types should have steamed greens or a salad every single day. I mean, every day without, I mean, that's got to be part of it every day. Bees really need to have that chlorophyll in their intestinal tract and then polyflora B. O blood types, we do well on glutamine powder and bovine colostrum and polyflora O. And AB blood types, bovine colostrum and polyflora AB. So even just those simple things heal up the intestinal mucosa with either aloe or glutamine or whatever, and then reseed the bowel of the friendly bowel bacteria with the polyfloras, depending on your blood type. And, it's a big head start. It's
Mhm. Right. And so it's not just what you eat or how you eat, but also the vitamins that you choose are dependent on a person's blood type.
right. Yeah, A blood types do very well on vitamin C. O blood types do terrible on vitamin C. I mean, just as simple as that. And there's way more. There's way more, but it depends how old you are. The older you get, I really believe it's true. The older people get, I think they just need to take way better care of themselves. Old cars need more maintenance than new cars do. And so once you get past, I'll say 70, I mean, you got to really, really, really pay attention to meal after meal after meal and exercise patterns and getting to sleep on time and what vitamins to take and all of it.
Mhm. Mhm. Yeah, and this might be going one step too far, but there's also secretor or non-secretor
Well,
status.
that's not going too far at all. So it turns out that genetically, 78% of the world's population secretes the blood type antigen into their saliva. Those people are known as secretors. 22% do not secrete the blood type antigen in their saliva. They're known as non-secretors. Non-secretors have no protective molecules for their intestinal tract. So non-secretors are way more delicate. If a non-secretor eats off, they pay in no time flat. You can find out your secretor status by calling the number 1-877-ABO type, TYPE, and ask for a secretor test. This test is done by swabbing the mouth with a Q-tip, mailing back into some lab, and you'll find out in about 3 weeks what your secretor status is. Knowing that is huge. If you turn out to be a non-secretor and you're going, what do I do now? Call me at 8 to 9 in the morning, Monday through Friday at 916-489-4400, and I'll give you a thumbnail sketch on what to do.
Yeah, I think that for somebody who struggles a lot with digestion or even a lot of teeth stuff,
Right.
learning that you're a non-secretor can actually just be so empowering. I've seen it with people over and over again, because where somebody who is a secretor just has more bandwidth and like can bounce back easier.
That is so exactly 100% true. Yeah,
Yeah.
non-secretors got to pay attention. That's all. They've really got to pay attention.
Hmm. Well, and also not only non-secretors, but as I'm listening to you, I'm just thinking about how so many people who have gone to see medical professionals throughout their life experience more of like a one size fits all.
Right.
Like, here, do the paleo diet, or here, do become a vegan,
Or
you know,
Mediterranean diet is the thing now these days.
the Mediterranean, you said?
Everybody should be a Mediterranean diet. They did a thing in Newsweek magazine where they did Harvard and Case Western Reserve and da 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 da, and they had 30 or so institutions, and they asked them what they thought the best diets were, and they put the top 20 diets for each institution. The blood type diet was not mentioned once. I mean, that's how far behind they are.
Why do you think that is?
Because they don't take the time to. I think there's a herd mentality, first of all. I think there's the like not wanting to go against the grain. And the other thing I think has happened, which is kind of sad on some sort of level, medicine has been taken over by corporations. And when I got to Sacramento, all the hospitals in Sacramento were owned by doctors. Doctors ran the hospitals. The nuns ran Mercy. There was the group, the board of directors were nuns, and Sutter was all doctors. They were just doctors running the hospitals. Corporations came in, and the dollar thing came to be. And now they were after the dollar, they weren't after the health. So what happens is once you go into the emergency room, they have a program there. Okay, we've got abdominal pain. We're going to take a CT scan of the abdomen. We're going to do this, this, and this. We're going to da 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 da. And it's like programmed medicine. Nobody listens. Nobody takes time. Nobody certainly asks the person what they had to eat the day before. They just don't. They just got their thing to go through and, try to put them in the hospital and make some more money.
Speaking of this, well, are you willing to share the case of the young kid who had was given popcorn at the hospital, who had had the bee stings?
I don't remember that case actually. I can't.
Oh, you shared it when you were here with Christopher and I. They were going to treat him for cancer.
Uh,
I thought he had bee stings or he had bug bites from being out in the.
I can't remember. It doesn't pop into my
Okay. I
frontal
just
lobe
remember
muscular cortex.
I remember he was a bee and they kept giving him popcorn and his belly was
Oh
distended.
yes. Oh yes. 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 Oh yes. Um, I forget who exactly it is now, but I remember the case, and I swear he is so great to this day. He really once he learned the diet, he was on board almost instantaneously. Yes, they had he kept bleeding down. They said he had some rare form of leukemia. He had to go through all sorts of chemotherapy and all that, and they straightened out. The parents were tough. The parents were super tough. They stayed with him every single minute, and yeah, he's great to this day.
Yeah, and did he have leukemia?
Well, he had leukemia in the sense that leukemia means his white blood cells were out of whack. And so, yeah, his white blood cells were out of whack, therefore he had leukemia. But once he got his diet corrected, B non-secretor diet, and he started drinking kefir, amongst other things, his white blood count, now he has no longer has the white blood cell count out of whack, so he no longer has leukemia. So I don't know, it was a cure as it just was a correction.
A correction that saved him from having cancer treatment.
Oh, saved him from God knows what.
Yeah,
Yes.
yeah,
Yeah.
yeah.
Oh, yes, I do remember that. It comes clearer and clearer as you say it.
Yeah, I was so astounded by the case. Like I felt so for the parents and for the kid of like, if they would have followed, they were at a pretty major hospital.
Stanford.
Stanford, yeah. If they
Stanford,
would have just followed what the doctors were saying, I mean, he would
yeah.
have been unwell, for so long.
Right? And who knows? We have no idea what would have happened, but
Yes.
Yeah, taking the popcorn away, but there it was, the whole thing of it. Yeah.
Yeah,
Yeah.
yeah, yeah. And you're an O.
Yes.
Yeah, and you eat really clean. And
Well,
you're
I'm
80 years old.
I'm neurotic. I'm neurotic about the diet because I found out about it in 1996, and I had the pleasure of meeting the author, Peter Diadamo, who wrote the book, Eat Right for Your Type. And I was on board the minute I met the man. I mean, he's such a great person. He's just such a great person. He just um, he's gone through the trials and tribulations of being called a quack and all this sort of thing, and he's hung true to his belief. And so I put myself on, and then I had you, and then Zach was a B, and we got him on the B non-secretor diet. And before you know it, I was totally convinced. And every single person who comes in to see me now knows their blood type, knows their secretor status, knows at least what I think they should eat. And it really pays off. I mean, it just totally pays off in spades.
Hmm.
And
And
then
go ahead.
then you put in intestinal function and you reseed the bowel, the friendly bowel bacteria with the polyfloras, and you get adequate amount of fiber, and you get a bowel movement that's just absolutely perfect every day, of formed stool that's easy to evacuate. I mean, it makes such an incredible difference to get the waste material out.
Hmm.
Yes, it's lovely.
And so if your patients are eating well, so they're empowered to be the agents of their own health,
Absolutely.
and they're remedied, so you're
Mhm.
balancing out their
Right.
energy body and their,
Hmm.
and their vitality. And you also, give supplements like we were talking about before, and then what's it called?
We do intravenous nutrients, I'll call it. We
Mhm.
do NAD IV and peroxide IV and chelation IV and amino acids IV and vitamin C IV in cancer cases and glutathione, lipoic acid, and all sorts of other things intravenously. We've got a lot of that going on. One other thing, uh, yeah, it slipped my mind, so I'll come back to it in a minute.
Mhm.
Yeah,
Yeah, what I was wondering is like, so given all of that, and you said before, and before you know it, you have a healthy person.
right.
What happens when somebody sort of deviates from, finding their way to health from this? What do you do then?
Well, I mean, I say to the person, I do the reverse psychology thing. I mean, I don't know if it really is reverse psychology, but this is how I go for it. I says, look, it's okay with me if you have pizza and beer every day for lunch. I personally don't care. I don't. It's up to you. It's your body. But my body is my best friend in this lifetime. It's the most important thing to me. I have to have this. I have to have this to talk to you. I have to have this to see patients. I have to have this to work out. I've got to have this, and I want it. I want this. I don't want to be 85 with a walker. I'm just not interested. I want to be 85 with muscles. I want strength. I want vitality. I want this brain working. So I mean, that's my goal. I mean, if you have that for your goal, good for you. If you don't, that's fine with me. Really, go to UC Davis, get some drugs. I'm for you having what you want.
Well, and I think what you're talking about, and I hear it all the time also, is that some people will say, like, well, but I love, like, if I would have said, well, I love salsa, I can't give up
Right,
salsa. And
right,
so it's like, just weighing the unknown of the potential health with the known of a flavor that
right.
seems good.
Well, the one thing I do in that case would be I say the age-old way to know if a food is good or bad is called elimination provocation. That's
Right.
the original thing. Eliminate the food that you are curious about, in this case, salsa, and then try it again with nothing else on your stomach in 10 days and see how you feel. See if you burp it. See if you get diarrhea. See what happens. Something's going to happen. It's going to happen.
Yeah. Yeah, but and what you were saying before about not caring if the person has pizza, that it's up to them,
Right,
is really, I think, a way that you're saying, like, I'm not going to save you
right,
from your habits that you do for yourself. Like,
right.
we're partners in your health here.
Right, right. Yeah, I'm fine, just if you have to learn the hard way, I get it. Maybe it's a knee replacement that'll get you going. Who knows?
Mm-hmm.
No, maybe you need to have a knee. I mean, one of my brothers who's no longer with us, both hips and both knees, and still wouldn't listen. Would not do the diet. I know he would not do the diet.
Right.
He was just to the end. He just, drank his coffee and had pancakes with blueberries and syrup on it and orange juice 5 days a week. I'm going like, really?
And I'm wondering, this is just an old memory I have from like the first time I read the blood type diet book many years ago. So again, correct me if I'm wrong, but is it true that blood types evolved based on the food that was readily available?
Yes, yes, they did. The body's adapted. So the B blood type people, for example, originally started in Mongolia. And because there was a lot of goats there and they had a certain limited amount of food. So bees do so well on goat milk, goat cheese, goat kefir. I mean, they really thrive on that. Yeah, so it is like that. And the O's came from Africa, and so it's basically meat, that type of thing. And the A blood types are more, European-ish. Yeah,
Incorporating grains, and then ABs are the newest blood type.
right. ABs are a conglomeration.
And as we are coming to an end here, thank you so much for just bringing all this wisdom and knowledge to this space. But I'm just wondering if there was just one thing that you'd want somebody listening who had never heard of the blood type diet before that you'd want them to consider. What would that be?
Well, I mean, first things first, find out your blood type. Find out your blood type for real. I think you can just walk into Quest Lab. You don't need an order slip from a doctor. And you can just say, I want to find out my blood type. And they'll charge you $50 or something. And they'll draw the blood and they'll say, okay, we'll tell you in 4 days. Once you know your blood type, then you can do the rest on your own. Pick up the book, Eat Right for Your Type. There's 3 categories of food in each different section. Uh, Highly beneficial, neutral, and avoids. To start out by avoiding the avoids. And so get that done. Then you can send away for the test, for the secretor test. And for another $125, you know exactly who you are genetically. And it's really pays off. And
Hmm.
there's a lot of there's an O blood type blogcast, or when people will get together and talk about how to be an O and how to be an A and how to be a B and their experiences with it. I mean, there's all sorts of things if you go on Diodamo's website, which is just diodamo.com, and all sorts of tips about how to be healthy relative to the blood type. Different patterns of exercise for
Hmm.
blood types. Yeah, so
Hmm.
cool.
Thank you. For me, that like helps to simplify the steps of even understanding how to integrate this. And the highly beneficial really is like food that acts as medicine
Oh,
in your
yes,
body, that is a healing agent. And neutral is just like calories.
right.
And then avoids acts like a poison, or it causes inflammation in your body.
Exactly, totally correct.
Yeah.
Yeah, I know. I try to always have the highly beneficials whenever I get an opportunity.
Hmm.
Uh, so I don't know, it just pays off.
Hmm. Thank you. Thank you so much for being
Oh,
here.
thank you. Yes, and happy Mother's Day to you.
Thank you.